Welcome to this episode of Youth Diary. Today we have with us Dr. Urmila, who is a leading gynecologist and a laparoscopic surgeon with PVS Memorial Hospital, Kallur. So doctor, welcome to the show.
Thank you.
So well doctor, if you could just explain to the audience as to which part of gynecology you are specializing on, it will be easy for us.
Actually, I'm specialized in laparoscopic surgery, more in the field of pelvic reconstructive surgeries. So that's an area where people overlook and they don't get proper treatment for such relaxation of pelvic organs, and definitely they land up with decreased quality of life and decreased self-confidence.
Okay. So then we have a few questions through mails also with us, So one of the mails actually says is, my sister is pregnant, and when she consulted doctor, the doctor said that she has pelvic organ prolapse. Now, what are the causes of this particular problem?
Actually, in this question, the age of your sister has not been mentioned. Thing is that in younger age group, particularly in this sort of patients, when they get this pelvic organ prolapse, there must be an inherent defect in their pelvic musculature or fascia, which is there when they were born itself. So whenever there is a stress condition like this, as in the case of pregnancy, there is a tendency of these pelvic organs to prolapse. So next question is what she can have now. Definitely she has to continue her pregnancy, get the baby delivered, and after that she can go in for a reconstructive surgery. Otherwise, this prolapsed pelvic organs will not go back to their proper position as they were before in the body. And this can be done either with her own ligaments of fascia, or you can use other materials like orthologous materials like mesh, tapes, etc. And that depends upon how much strength her inherent ligaments and fascia can provide for her later support.
So doctor, we were talking about this prolapse. Now, what are the corrections that can be done, and can a person be pregnant after these corrections are done?
Yes, surely, as I have already talked to you earlier, these pelvic organ prolapses, they can present at the earlier stages of life. When that happens, definitely before surgery, if you get this corrected, you can have pregnancy after correction also. So in such cases, definitely orthologous material like meshes or tapes has to be put in to take care of the problem.
So we spoke about correction and all, but exactly what are the causes of this particular problem, ma'am?
When this pelvic organ prolapse, when it occurs in younger age group, this is mainly because of the inherent defect in their fascia and musculature, where there doesn't have enough support for the whole system.
So doctor, this is over to the audience side. They have few questions for us. This is the first question.
I'm Rini from KME Engineering College. I have a doubt what it means that we have irregular periods.
The normal menstrual cycle is a 28-day cycle. Actually, first 14 days you have the proliferative phase, and the second 14 days you have the secretory phase. This is the normal pattern, 28-day cycle. So irregular cycles means if you are going to get your periods once in less than 3 to 2 weeks, or if you are getting it more than 45 days duration, you are supposed to have irregular periods. So in both the cases you will have to take treatment, because if you are going to bleed every 2 to 3 weeks, then what happens is that you are going to become deficit in hemoglobin. That means in a normal menstrual cycle you are supposed to lose only about 60 to 70 ml of blood. So when this happens quite frequently, then definitely the blood loss will not be enough for your body resources to compensate for that, and you will definitely land up with anemia. Now, what happens if your cycle get prolonged? So what happens is that when you are getting your cycles once in 45 to 50 days, 60 days, in such cases, if it is going to get prolonged for more than 2 months, then definitely you will have to consult the doctor and take appropriate treatment for that.
Because of this, I think there can be even weight gain.
Majority of the cases like this, when you have this prolonged cycles, This is commonly associated with a condition called polycystic ovarian disease. In such cases, what happens is that there won't be proper ovulation.
This is the next question.
I'm Sneha from KME College, and ma'am, I would like to know why I suffer from abdominal pains during my regular periods.
Normal menstruation, what happens is that there is a lining inside the uterus called endometrium, and this is being shed regularly during your periods. So what happens is that once the hormonal withdrawal occurs, then the uterus will start acting, that is, the muscles of the uterus will start contracting, just causing this blood and the endometrium to come out of your uterine cavity, and this is the cause for pain during menstruation.
We have one question, doctor, that is which is the commonest age group for pelvic organ prolapse? And there is one more question associated with that, which is like, can you get POP even after hysterectomy?
Okay, about 60% of the patients having pelvic organ prolapse will be above 35 years of age. This is because once the lady gets into 35-40 years, the hormonal estrogen, particularly the estrogen, which is responsible for the feminine characters of the body, this estrogen start decreasing in the body.